Along with grids to reduce scatter radiation, we also utilize beam restrictors and the air gap technique. Grids are great at reducing scatter radiation anywhere from 85 to 97%. Other tools at our disposal are aperture diaphragms and cones or cylinders. Aperture diaphragms are simply a sheet of lead with a hole in it. A cone or cylinder is anything we attach to the bottom of the collimator housing to help focus the X-ray beam. You see these often in dental offices. However, the most common beam restrictors are the variable aperture collimators. They come in many different designs, but they all do the same thing: limit the size of the X-ray beam. As you adjust the dials, you are moving lead strips that are at least 3 millimeters thick inside the collimator housing. This helps you control the size of the X-ray field. Finally, you have an option of using what's called an air gap technique. This is good for reducing scatter if you don't have a grid easily available. To utilize the air gap technique, you need to move the image receptor away from the patient 10 to 15 centimeters. By moving the image receptor away from the patient, you are reducing the amount of scatter that reaches the image receptor. This technique acts as an 8-to-1 grid, so you'll need to increase mass by about 10%. A couple disadvantages of using an air gap technique is the increase in technique and the increase in object magnification.